There are personal and family barriers when it comes to healthcare. One is acceptability, which is an unaffordable cost to households, weak availability of inputs and services, and poor acceptability between the social interaction that accompanies care. Another is cultural. Men feel ashamed about asking for help. Working and supporting one's family is valued over self-care. Different ways of understanding illness, wellness, conflict with or don't match Western medicine. People feel like the provider didn't actually understand, address, treat the self-perceived or self-diagnosed problem, so patients ignores, adds to, or self-modifies any treatment given and cultural trust in medications to solve illnesses or symptoms. If no medication is given, the patient thinks no useful medical care happened. Literacy and language, which is the triple threat, which are low health literacy, cultural behaviors, and limited English proficiency. Nurses working with patients experience daily challenges of these threats of how to offer effective provision of health care at the system, provider, and patient levels. Attitudes and beliefs. There are misperceptions about complementary and alternative medicines when it comes to healthcare. Many health beliefs and behaviors are culturally based, which can lead to delayed or inaccurate diagnosis and poor treatment outcomes when it comes to traditional healing methods due to side effects. Preferences. Patients' preferences result from anticipated treatments of health outcomes through evaluation, which also influences healthcare choices. Preferences results from cognition, experience, and reflection when it comes to consequences and values, because care will most likely be cheaper, more effective, and closer to the individual desire. Involvement in care, awareness and understanding of what patient safety is, self-efficacy, refers to the ability of patients to perceive themselves as playing an important role in error prevention. Demographics have been shown to have some impact on patient involvement in error prevention strategies. Legality as to how involvement would change the responsibility of both provider and patient. Facilitators' engagement in provider behavior or physician modeling and willingness to participate. Health behavior, patient level, demographic and social structure variables, health beliefs and attitudes, personal and community enabling resources, perceived illness and personal health practices at the provider level, skills and attitudes at the system level, organization of the healthcare system, education and income, a lack of insurance coverage, poor access to services and unaffordable costs. Education is critical to social and economic development and has profound impact on population health. It is also important to consider the impact of health on educational attainment and the conditions that occur throughout the life course, which can impact both health and education, such as early childhood experiences. There are also structural barriers of healthcare, which is availability. It occurs when services are located only in more urban areas, creating barriers for remote, rural populations or during hours when those working are unable to come for services, and also a lack of access to appropriate health service and extending waiting times. Appointments. Increasingly strict documentation being requested. For example, photo ID, passports, or birth certificates. Expired healthcare coverage due to unawareness of renewal. Long wait times in public clinics and hospitals. No social security card or legal residency. Multiple healthcare providers. Many step process to get healthcare. Few straightforward referrals due to case by case, so providers can't or don't take time for referrals, so they are unsuccessful. How organized? The push with quality improvement rests with assuming small and large medical and healthcare organizations will engage in quality assessment and assurance from a 5-point system model: technical, structural, psychosocial, managerial, and goals and values to include education, training, and research and development needs to support quality improvement. Transportation. Bus van transportation vans have been developed for basic medical services, but may not be sustained since they are not reimbursable services. Okay.